Hello, this is Richard Keddington. I'm the CEO at Watertown Regional Medical Center. I'm here with Chris Allen, one of our great nurses that we have here. We're going to talk about the Cath Lab and lots of different things. Thanks for joining me today, Chris.
Absolutely, Richard. Happy to.
Great, thanks. So how long have you worked here? What departments have you worked in? Just give us a background about you.
So I came to Watertown some years back, worked in the ER predominantly, and then just this last year in 2020 decided to hop over to Cath Lab and see what it was about, and been there since.
Perfect. So you talked about the Cath Lab there. What is the Cath Lab? What happens in the Cath Lab? Just kind of give an overview of that.
For sure. So Cath Lab, we refer to it this aspect as a cardiac cath lab. So basically what we do is we have a specialized x-ray machine in a very clean, sometimes sterile room, depending on the procedure, that we use minimally invasive tests, basically accessing arteries or veins by either the cardiologist or the radiologist, depending on the day, to take pictures, diagnose, and treat what would have used to have required an open surgery for. So more or less think of us as the plumbers of the cardiac world, fixing the vessels and legs and hearts, for the radiologist, some spines and things of that nature that, you have a tiny puncture site in a vein or artery versus a large open surgery to mend. So
got it. I love the analogy of the plumber. I think that's helpful for non-clinicians like me.
Oh, for sure.
So when is it open? What kind of conditions do you treat? Just kind of talk through that a little bit.
So here recently, we have moved to a 24/7, 365 model. So morning, noon, or night, if you have heart problems, we're available to fix them in emergent situations. We, in the past have just done kind of a business hour program for our procedures, but with the addition of our two new interventional cardiologists, have been able to move to giving this service around the clock to the community. We're not in-house on the after hours, but we're available on call. We have two circulating teams, so it's not just me coming in haggard and tired every single day, but fresh eyes depending on the situation. Yeah. And basically what could happen in an ideal world is we hop in, during the day we're doing our procedures, go home in the evening, and if somebody comes into the ER with an emergency that requires urgent intervention, instead of shipping them out, which was the way of the past, our cardiologist is paged, and then we, the team, are paged and respond, come in, and we take care of what needs to be handled in real time right here in Watertown.
You know what I love about this is, a year ago or 6 months ago or whatever, if somebody would have had a heart attack in the middle of the night, right, they would have had to go somewhere else. Whereas now they can get that care closer and faster, which is actually better for preservation and recovery and all those things, from what I understand. And I was talking to somebody about this recently, and they said, well, doesn't every hospital do that? And I said, well, no, most hospitals actually don't have the ability to do that. And I think we've looked, and it's something like out of the 6 hospitals within 30 minutes around here, I think we're only the second one that's able to do that, which I think the public would be pretty amazed at. So I think you guys are doing some pretty amazing things over there. So what else do you want the community to know about our Cath Lab or our emergency department? You worked there for a couple of years. What else do you want people to know about Watertown Regional Medical Center?
So a couple of big things. We've, have gotten some new providers in that have had big hospital experience, that want to serve, a more tight-knit community. So when you hear regional medical center, don't think of, just some small hospital in the middle of nowhere that, doesn't know what they're doing, the old chop shops like they used to call them. But
that's an interesting phrase.
Yeah, right. Yeah. And these docs have, been doing this and been trained professionally and been fellows and have seen the big time things and know the latest and greatest and stay on top of that. And they come to places like this to aid in the community and help out. So we have chest pain accreditation, which not every hospital has either. We're looking to advance that as we move forward with our program as well, getting higher and higher, which is just basically meeting more rigid quality and outcome standards. So the longer we do this, the more good outcomes we have, the higher that accreditation gets up to where we're on par with, the tertiary centers that lie around us. So in a regional center like this, you get the big town experience in the small town environment. It's more direct. The cardiologists know you by name, and you get to see the people doing the work, not just their interns or, residents, stuff like that. To the point you made about the the 24/7 service.
Mhm.
Being where we are in Watertown, we're very remote between Milwaukee and Madison. It's kind of equidistant between the 2 points. So the region that we serve encompasses up to Beaver Dam, potentially, down through Juneau, Waterloo, Lake Mills, and just north of Fort Atkinson and areas like that, of areas that we could potentially service where you're closer to us than you are to those bigger centers. And with EMS pre-notification, things like that, just the transit time alone can save you quite a bit of time and help your heart get back to its good open plumbing standards faster than anywhere else would be able to. So
Perfect. Great. Well, I just want to finish by thanking you for the people in the Cath Lab. We do such a great service, and I'm always in awe to think about what you and your teams are able to do so quickly to help people. So thanks for being here. Thanks for fulfilling our mission, making communities healthier, and thanks for being a great person serving our community.
absolutely, Richard, happy to do it.
Yeah. All right. We'll talk to you later. Thanks.
Bye bye.